Good afternoon. Thank you for being here for this briefing. I'll provide today just an update on the situation related to the COVID-19 cases in children who attend Westwood Primary and Eliot River schools. Late yesterday, we became aware of 4 new cases of COVID-19 in P.E.I. These cases are members of the same household and are linked to travel outside of P.E.I. 2 of these cases are individuals in their 30s, and 2 are children under the age of 12. One of the children is a student at Eliot River School, and one is a student at Westwood Primary School. All these individuals originally tested negative November 1st, and then tested positive on a subsequent test yesterday. The children attended school on Wednesday, November 3rd, when they may have been infectious and able to transmit COVID-19. The children were not symptomatic at the time when they attended school last week. However, as we have discussed before, prior to symptom onset and test results, individuals may be infectious. A decision was made to close Westwood Primary and Eliot River schools for 1 day to allow time for public health to complete investigation and contact tracing, for students and staff who are close contacts to be tested, and for the school to undergo a deep cleaning. Last evening, most of the close contacts of the cases, including schoolmates, were contacted and advised to be tested at one of the health P.E.I. testing clinics today. The remaining contacts were called this morning. There are 55 close contacts. As part of our investigation, we learned more about the case, the seating arrangements, the masking, and seating arrangements on the bus, and the time spent on the bus. As a result, the children who traveled on bus 81 to or from Westwood Primary School on Wednesday, November 3rd, are not considered close contacts, and as such are being asked to be tested today and then monitor for symptoms of COVID-19 until next Wednesday. Although we never want to report cases of COVID-19 in children who are not eligible to be vaccinated, this situation is significantly different than the situation we had with school cases in P.E.I. in September. Based on initial test results, we are not dealing with a school-based outbreak at this time, but rather isolated cases in 2 schools. And we, of course, will know more when the results for all close contacts are available. The source of the cases is known, and they are related to travel outside of P.E.I. We know where and when and the type of interactions that occurred. We are confident the exposure risk is low, given the cases attended school on 1 day, Wednesday, November 3rd. They were asymptomatic at the time, and also today is day 5, and they will have a PCR test, and if they are negative, this is also reassuring. The schools remain in an elevated risk, enhanced public health measure that requires enhanced cleaning of commonly touched surfaces, cohorting of students in grades K to 6, and masks are to be worn at all times for students in grade 4 and up, and by younger children when they are transitioning through the school. Based on a risk assessment completed by public health, and based on the specifics of this situation, we will be implementing a daily testing for school contacts protocol for asymptomatic close contacts at the school as an alternative approach to the management of school-based contacts. This protocol will allow children to attend school as long as they do not have symptoms of COVID-19. To be eligible for the protocol, a child must have been exposed at school and have at least 1 negative PCR test. Similar to what is being initiated in some other jurisdictions, we'll be asking all asymptomatic close contacts to be tested today with the PCR test, and then each morning using a rapid antigen test, and have a negative result prior to going to school or participating in activities. We are asking children who have been identified as close contacts to begin the daily testing tomorrow. Children who are close contacts must bring their negative test kit to school for verification by school staff. An important element of this protocol is for close contacts to have one additional PCR test on Friday, November 12th or Saturday, November 13th, and then resume daily antigen tests until November 17th, including days when there's no school and the weekend. Parents and guardians can pick up a supply of rapid antigen tests today at either Westwood Primary School or Eliot River School this afternoon before 6 p.m. Some families may have some rapid tests at home that can be used tomorrow and can pick up their additional test kits tomorrow. For families whose children are close contacts at both schools, they can go to either one of the schools to secure enough test kits. Only those children who have been identified as close contacts need to follow the daily testing protocol. This protocol will allow asymptomatic children who are close contacts to safely attend school and benefit from in-class learning. They will also be able to participate in extracurricular and recreational activities. This protocol minimizes disruption for families and communities. Most importantly, children who are close contacts and one of their parents will not be required to self-isolate. If a child tests preliminary positive on the rapid antigen screening test, the child should self-isolate with a parent or guardian until arrangements can be made to have a lab-based PCR test at one of the health P.E.I clinics. They should self-isolate until they receive a negative PCR test. If the rapid antigen test result is invalid, it should be repeated immediately. If a child develops symptoms of COVID-19, they should not attend school or participate in extracurricular activities or recreational activities, and they should be tested at a health P.E.I testing clinic. Parents and guardians should advise the testing clinic their child is a close contact. If a parent or guardian decides not to do daily testing, the child will be required to self-isolate for 14 days from the last contact with a positive case, which in this case will be until November 17th. And all the close contacts will be called by public health nursing. Those calls are underway now. To reiterate, it is for the close contacts only for this protocol. The implementation of this daily testing protocol is a positive step as we continue to navigate our way through this global pandemic. We will be modifying the protocol as we go forward, and the specifics will be determined based on the risk assessment completed by public health. In closing, thank you to the parents and guardians of students of Eliot River and Westwood Primary Schools, as well as teachers and staff for their understanding and cooperation during the last day. We thank everyone who arranged for children who are close contacts to be tested today. And thank you to the staff of the testing clinics and the provincial lab for your continued support and professionalism. And I will say I did have a chance to help make some of the calls to parents last evening, and I appreciated how receptive and cooperative the response was that I received on the phone. So, as always, and I think the longer we're in this pandemic and global pandemic, we need to continue to be patient and kind towards ourselves and others. Okay, thanks, and I'll take some questions. Today we'll just take questions related to this, this situation as opposed to more broadly. So maybe I'll start with you, Brittany, in the room.
So I just wanted to clarify to start. So both schools, Eliot River and Westwood, will be open tomorrow?
Yes.
Okay.
Yes.
I'm wondering, for any students or any families that decide not to do the daily testing, will there be at-home learning options for them?
So that's probably a good question, more for education than for me. There's a total of 55 really close contacts at both schools. So the number of students at each school is actually quite, it's not too big. And what options they would have. I will note that there's only school Tuesday and Wednesday, and then there's no school Thursday, Friday, Saturday, Sunday, Monday, I believe. So there's quite a few days without school for everyone. I think that will be a question really for any parent in those groups that are not wanting to do the regular testing. We'll have to ask the school system.
And now I know you did go over how this situation is different from the West Royalty situation. I'm just wondering if you could further clarify, is it because of precautions that are in place that weren't in place during the West Royalty situation? I guess what is it specifically that makes this a lower risk?
Well, I think when we talk about the West Royalty situation, we did not have a source. I mean, so I think that's pretty key. So we didn't have a source. We didn't know the extent of the situation, and we quickly went from one case to really an outbreak at that school. So this is a little bit different in that we know a source. We know the time of the exposure or potential exposure. And so it's more limited. We know that the students were asymptomatic, so no symptoms at the time. It's given us a chance to have multiple discussions with public health nursing and the cases and the school about if masking was in place, how long they were on the bus, what students they played with at recess. So those are all things that we have a much better sense of this time than we did previously.
And now I was wondering, the 4 new cases all initially tested negative and then tested positive the second time. Was that second test taken because symptoms had developed?
They actually did, so it was for routine testing, so they had gone for routine testing.
Because of travel?
Yes. And now one, it was around the same time that one did develop some symptoms, but the household did go for routine testing.
Okay.
All right.
Okay.
Afternoon, Dr.
Thank you.
Morrison.
Thank you. Hi, Stu.
Well, I guess first question, and apologies if this was mentioned and I missed it, but
Okay.
so the release mentions that there is an exposure on November 3rd. The 2 children attended the 2 different schools November 3rd. What about November 4th and 5th? Were there exposures on those days?
No, the students were not at school on those days, and then we go through, as we do for all the cases, any other exposure outside of school notifications. For instance, they did not participate in extracurricular activity on either one of those days.
Okay, and it sort of seems from talking to the public schools branch that much of the contact tracing is focused on that bus 81. Is that correct? I mean, is there sort of, more contacts from the bus or more from the classroom?
So I think I'm glad you asked, because I don't think it's important that really it's the close contacts of other students in the same class or friends they may have played with for any period of time. Those are considered the close contacts. Those who are identified on the bus are not being considered close contacts. And again, that was based on the information we have learned from speaking to the bus driver and the case and more information. They were all asked to be tested today, and then for those who were on the bus, and then continue to monitor for symptoms.
Okay. All right, then I guess the last thing I have is, so the 2 individuals in their 30s who were identified last night, would they be considered breakthrough cases?
So yes, they would be considered breakthrough cases, and which we know happens more often when there's really close contacts, and certainly household close contacts with those who are unvaccinated. So I think and we know that we've talked about this before here, Stu, that the vaccine's not 100% effective, but it will reduce your chance of being hospitalized by 25 times, according to the national data. And if you're vaccinated, it will decrease your chance of being able to transmit the virus to others, and less chance of you being sick. So for both those reasons.
Okay. So just to reiterate this, for parents who might want to access take-home rapid tests, they're basically just, they can visit the schools. That's generally where a parent would go to access those if they don't have one?
So we've announced some, I think it was last week, talked about our distribution of rapid testing kits, or these antigen tests that were being distributed to access P.E.I sites across P.E.I, specifically for pickup, primarily for children kindergarten to grade 6. And we also had made them available for schools if any one requested them to go home with parents. So all the schools have some, and all the early learning centers were given test kits as well. So today it's really to try to make sure that the close contacts that we have identified all have access to enough tests to continue to test over the next 10 days. And so they are going to be able to go this afternoon to get those, and they're being called individually and said, come to the school and we'll give you all the test kits you need.
I guess just last thing for me, I mean, are you able to sort of say where the travel is from, like whether it's a province in Canada or?
We just say that the travel is off island, and that's really consistent with what we've talked about before. And there are certainly requirements for testing and isolation if from the federal government that are put in place, as well as provincially as well. So, that's what we've done right along.
Sorry, of the 50 plus contacts, are we still waiting on the results from most of them?
So we don't have all the results back. I know that there's, I think the last I heard, the information I had just before I came down here was that we know at least 48 of the 55 close contacts have been tested, and which is great, and some of those results have come back. We know there have been at least 200 that have been, indicated they were associated with the school that have come back negative already to date, so they'll be matching those up. And certainly they will not be going back to school without a negative test, and I'll be calling them if any result is positive.
Thank you.
Louise Martin, CBC.
Oh, hi. Good afternoon, Dr. Morrison. I'm just wondering, we've been talking a lot about the 2 students and going to school. What about the parents in this case, the 2 other people? Were there any public exposure areas? Have they been in isolation since coming back? And I understand because there would have been routine testing along the way.
So, Louise, with all these cases we go through, and we announce public exposure notifications on a regular basis. If there's been exposure to a particular work site and 2 or 3 people need to be tested or have been exposed, we do the follow-up, and we do include them as close contacts. So there are no public exposure notifications with the 2 other cases.
Thanks. And can you just clarify the testing regime? Because my understanding is children have to be tested on day 4 and day 8 when they come back to the province. And so that would have been, they arrived back on the 1st, should have been the Thursday. So I'm confused about the timing of the routine testing that would result in a positive test result.
I guess a couple of things. One, I think we should, but really to Stu's question, there are protocols that are a little bit different for federal travel and provincial travel, and I think those are requirements that are federal requirements and our own provincial requirements. The children in this case attended school for 1 day, 2 days after their negative test, and they did not go back to school after that 1 day. And then they were tested on, I guess it was day 6 yesterday's. So that, I mean, the federal website certainly outlines the criteria for testing from the federal point of view. And as you mentioned, provincially, we also have our testing requirements. If you're going to be at school, you have to have a negative test before you go back to school, and also on day 4 and on day 8 if you're at school. So I think those are fairly well laid out.
Oh, okay, so I'm assuming it was international travel if you're quoting the federal guidelines?
No, I'm just outlining both the provincial and the federal requirements. And in this case, there is the testing of the children. It's not that they went to school and should not have been tested, or that they were at school and should have been tested prior to them going.
Gotcha. Okay, thanks for clarifying that. And can you just as far as this new sort of protocol that would be, sort of a departure from previous guidance in going to school and having these antigen tests, can you just relay, why that protocol is a good way to go this time around compared to, you mentioned the differences between this and the West Royalty outbreak, but going this route, a rapid test and allowing kids to stay in school, why that is important at this point?
Well, I think I'll maybe reiterate some of what I mentioned to Brittany as well. I mean, I think it's important when we look at the risk. We know how disruptive isolation is for parents and for students. We know in this situation it's already day 5 from the exposure today, so that if we have a negative PCR test, that is reassuring. We also, as we mentioned, we know that the cases were asymptomatic, no symptoms at the time. It was one day. We know exactly where the exposure happened, and we know the source. And I think it's important that for those young children who are not able to be vaccinated, they do not have that option yet, that we do everything we can to try to keep their routine in place for them and for their parents. We know that it's if we can reduce the risk and be comfortable with this kind of testing protocol, then I think it's certainly less disruptive for society as well. So I think it's I think a good thing to be doing in this situation, and we'll certainly see how this works, and it's. But I think this is a good protocol to as an alternative in this situation.
One last quick question: are you relieved at this point? I know your heart probably skips a beat whenever you hear about a case related to a school. At this point in the game, I know it's still early and still results coming in, but do you feel fairly confident that this can be contained?
Louise, I am feeling, I don't know, cautiously optimistic at this point in time. But you're right. I think we all the whole team inhales and holds our breath when we get the call about this type of case. And but I am certainly hopeful that there won't be further spread of these cases in the school, and I don't want anyone else to get sick or there to be further spread. And I mean, I think, and I share that with everybody, with you and others in the room here, and with all the other parents and educators as well.
Thank you very much.
Yeah, thanks.
Gabrielle Drummond, Radio-Canada.
Bonjour, Dr. Morrison. Ma question, c'est par rapport à ce nouveau protocole de dépistage qui va permettre que les enfants des 2 écoles puissent assister aux classes en personne à compter de demain. Alors, est-ce que vous pouvez, s'il vous plaît, nous expliquer comment ça va fonctionner, ce nouveau protocole, et pourquoi ce sera important de le suivre?
Bonjour, Gabrielle. Alors, c'est vraiment important de le suivre parce qu'on ne veut pas qu'on manque des cas et puis quelqu'un entre à l'école ou d'autres activités sans avoir un test qui est négatif. On sait que les tests qui sont plus rapides pour les antigen tests ne sont pas si précises vraiment que les autres PCR tests. Mais alors, pour cette raison, il faut avoir un test. Aujourd'hui, c'est le jour 5 pour le test PCR. Et puis après ça, chaque jour, il faut faire un test avant d'entrer à l'école ou avant de faire les activités. Alors, on va faire ça jusqu'à mercredi prochain. Et puis, en plus de ça, on va voir un autre test PCR vendredi ou samedi. Et puis, si vous avez des symptômes, il faut s'organiser pour avoir un test aux cliniques. Et puis, il faut présenter le test rapide à l'école demain matin ou mercredi matin quand ils arrivent. Et c'est pas pour tout le monde, Gabrielle. C'est seulement les jeunes qui sont contactés par Santé publique qui sont les contacts les plus proches.
OK. Et pourquoi vous vous sentez assez à l'aise pour autoriser cette ouverture, cette réouverture des écoles Westwood et Eliot River demain? Est-ce que vous pouvez nous expliquer pourquoi vous êtes assez confiante pour autoriser cette réouverture?
Alors, c'est pour plusieurs raisons. On sait, on connaît la source des cas. C'est lié au voyage. On sait le jour que les étudiants ont présenté. Ils n'avaient pas des symptômes ce jour-là. Ils ont porté leur masque. On sait qu'il y avait un test négatif 2 jours avant ça. Et c'est vraiment, on veut être certain que les autres contacts qui sont proches dans leur classe ou leurs amis ne vont pas devenir positifs. Alors, j'espère que tout va aller bien. Mais on veut... on veut pas que si le risque est plus bas, on veut pas que on mette tous ces étudiants pour isoler, parce que on sait que c'est assez difficile pour les familles et pour les jeunes.
Tout à fait, tout à fait. Donc, vous pensez qu'on ne risquerait pas à ce moment-ci d'avoir une éclosion dans ces écoles, comme on avait vu, par exemple, dans l'école West Royalty il y a quelque temps. Donc, il n'y aurait pas en ce moment de risque d'éclosion dans ces 2 écoles, à votre avis?
J'espère que non, Gabrielle. Alors, si on a des résultats ce soir qui change le plan, on va annoncer ça, mais à ce moment, avec les résultats qu'on a, ce qu'on sache avec l'histoire des cas, j'espère que ça va aller bien. Okay. Thank you, Gabrielle. Merci beaucoup. And I think...
merci beaucoup.
Merci. Okay. I think that's it. So thank you very much.